Okay, good morning class. Our topic for today is bandaging. And definitely you have learned about certain topics about soft tissue injuries as well as bones, joints, and muscle injuries, and definitely burn injuries. So, I told you that there are certain emergency measures that we have to do, and one of the emergency measure is to do bandaging. Now, bandaging is used for compression, so we could stop the bleeding. Second, we have to immobilize if the patient has fractures, sprain, strain, and the likes. No? And also, we also have to use it as a cover. We call it cover bandage so that it would not give any infection. Now, what we are going to use is a triangular bandage. So this is a triangular bandage. Okay, as you can see. Okay, there are parts of the triangular bandage. So on the bottom, we call it the base. It's the base. At the top, this is the apex. And we have two sides. Okay? So the first thing you have to learn is how to do a square knot. Okay, so a square knot is right over left, under and over, and then left over right, under, and then close. Now, how are you going to check whether you have a correct square knot? So you have to pull one side, there, and then voila. Okay, I repeat, it's right over left, over and under, right or left over right, over, and then close your knot. Check. Okay, pull one side, the left side, going to the right, and then you pull. The knot is out. Okay, why is it that important that you have to know the square knot? It is very important that you use a square knot so that you don't have to cut it. It's easier to remove, and also the more you have to pull it out, the more it becomes stiff. Okay? Okay, so now we have a demonstration. So our demo is how to put the bandage on different parts of the body. So the first thing we have to do is compression bandage. So let's start from the head, sa ulo. So what you need is a gauze. No? Okay. So a simple wound like wound in the forehead. So you have to put the gauze there. Okay? Hold it. Let the patient hold it to stop the bleeding. And we have our bandage. So we have to do a cravat. What is a cravat? To make it smaller. Okay? So to make it smaller, you have to do this. Okay, now, put the center of the bandage at the center or where the wound is. Okay, and then tie like this. You tie it in the front, not at the back. Okay, so make a square knot, right over left, left over right. Don't let this be loose one. So, a bandage should be clean and correct application. Okay, so when it's time to remove, it's easy to remove if it's a square nut there. Now, you could check your dressing. And if you have to change, you could change it very quickly and tie it again. Okay? The second, what if you have a wound on top of the head, like this? There. You let the patient hold this. You have to open your bandage. And then, place it this way. Okay. Make a type of bandana. There. Make a square knot. Right over left. Left over right. And then keep it. Okay, so how about the back? So how are we going to look at the back? Okay. If you want to look at the back should look like this. So you have to get this and then fold it to make the compression on top. Get it? Okay. Now I'm going to take it off. Okay, now, how about on the side of the head? It should be like this. Or on the ears. Hold. Make a small cravat again. Making a small cravat is from the apex towards the base. Fold it. Then fold it again. Now, you have a small cravat. Bring the center there. Okay? After bringing the center, you go back here. On the other side, you have to make a figure of 8. Then you have to tie it here. Right over left. And then left over right. To make the compression. Now, you have a bandage of a person with a accident or a wound on the side or on the ears. So you can take it off again. There. Okay. Now, what if the wound is on the side of the neck? You have to hold it. Put the center again. Fold it this way. And then bring this to the other side. Not too tight because it's on the neck. Now, when you reach the end, you just have to insert it. Never tie. Okay. Then get the other end. Go to the other side. And then insert it again. Now you have a compression bandage if you have an injury on the side of the neck. On the arm. There are two types of wound on the arm. This is horizontal and the other one is vertical. So, dun muna tayo sa horizontal. So, definitely, when you do the horizontal one, you have to have a horizontal dressing. So, this way. Okay, get it? Horizontal dressing. So, put the center there where the wound is. Put one end on the other end and the other part on the other end. Okay, so you just have to put it this way, round, then at the end you have to tie above where the wound is. Square knot again, right over left, left over right. Be sure to make it clean. You have to keep those ends by inserting it. So, there. Okay. What if the wound is horizontal? So, take it off. So, that's a vertical wound. Now, this is a horizontal wound. So, this way. So, we have to close the wound this way also. The other one is this way. So, pag ganun. Okay. Place it like that. And then, there. You make a letter X at the back. Okay? There. Tie it. Tie it at the center where the wound is. Okay, square knot again. So, it is easy to remove and change the dressing. Okay, let's remove. Now, let's go to cover bandage. If we are going to use a cover bandage, we have to use it an open cravat. So, this is an open cravat. So, if we have a cover bandage, we have to use many dressing kasi cover bandage is used for patients who are burned. So, you have to put like that on the area so that the skin of the fingers won't stick together. So, you have to hold it that way. Taas lang. Put the apex and bring it this way. And then, the base towards here. Get one end and the other end. And then, do not tie. You could tie it once, but not too tight so that we could not impede the circulation. Get the end and then close it there. Make it clean. So, it's just like making mittens. Get it? Okay? So, take it off. Now, let's do some immobilization. So, we do immobilization. Usually, we immobilize the elbows. This is elbow flex, elbow straight. Okay, usually the injury could be at the elbow or here. Now, if there is no wound, we don't need any dressing. So, in elbow flex, you have to put it this way, okay? And then, there. One at each side, alternating. And then, you have to close it here. At the brachial part. Okay. So definitely, it should not go straight. Okay? Hindi ganyan. So, hihigpitan po natin yan. It should be rigid or stiff ang pagkakatali. Okay. Now, if it's elbow straight, you have to put it this way. There. Leave it there. Then like this on the other side. And then tie it at the back. You have to tie it here. There. At the joint of the elbow. So it won't flex. There. Should be square knot, so it's easy to remove. Tie it there. It should be clean. So remove it. Okay. Okay, so the last I'm going to show you tonight or today is your simple immobilization technique of the wrist. Okay, so if somebody has an injury on the wrist, you have to immobilize this by making a small sling. So, get the center there, then get one end over, like this. So, it looks like a letter M, or McDonald's. You get the other one and put it inside. And the other one outside. Okay, now, it should look this way. Now, you have to hold it. And then, place it this way and tie it securely at the nape by using square knot. Okay, so that's it for today. Tomorrow we're going to do bandaging of the hands, open injury and close injury, and also we're going to make a big sling over here, and then injuries of the shoulders. If there is a wound or there is dislocation, we have to immobilize it. That's for tomorrow, as well as injuries of the knees and injuries of the foot. Okay, thank you very much.